All right, time is 7 o'clock, so let us be on time. And I'm sure that other participants will join in the meantime. Ma'am is already with us, and on behalf of MTC Global Family, I extend a hearty welcome to all the participants for this 2 days workshop. And it's my great pleasure to briefly introduce ma'am. Dr. Anjali Upadhye ma'am is having over 35 years of teaching experience at different level. Currently, she is working as a professor of management and professor in Central Research Facility Center, JSPM University Pune. Previously worked as a senior approved teacher in research methodology and biostatistics in Maharashtra University of Health Sciences, Nasik, and also worked as IQAC coordinator in the institute. Ma'am has worked as a quarterly peer-reviewed online journal, Indian Journal of Odyssey of Ayurveda with ISSN 2456432X with SRIJ impact factor 5.986. Being selected as faculty for Advanced Research Methodology Training Workshop from Maharashtra University of Health Sciences, Nasik, selected as faculty for Health Education Training Programs from Maharashtra University of Health Sciences, Nasik. As a research contribution, ma'am has published 7 books on quantitative techniques of management, statistical glossography of women entrepreneurs in Western Maharashtra, constructivism of medical statistics, statistical inference volume 1 2 with ISSN numbers, published 35 index international and national research articles and papers, and offered statistical consultancy for educational projects, conducted 30 research methodology workshops, worked as a key resource person in 32 different institutions all over Maharashtra. It's a great pleasure, ma'am, to
Thank you,
accept
sir.
our request to conduct this 2 days workshop. In fact, ma'am had taken in the past many workshops under the banner of MTC Global, and all the workshops were very well received, and those were excellent. So we are looking forward to listen to you, ma'am. Kindly please take over the session. Thank you so much.
Yes. Thank you, sir. So, good evening, all of you. First of all, I welcome you here at the Research Faculty Development Program or this particular research workshop. Actually, from many years, I am dealing with this particularly research workshops because I am being a research faculty for the many universities. One of them universities are the one of the JSPM University as well as the Maharashtra Health Science University. But the thing is that wherever the research word comes over there, the many minute and major aspects are there that the students actually don't understand. Sometimes I feel like I'm a magician because students directly come to me and ask me, ma'am, this is my title of the research, and tell us a sample design, or tell us a research design, or tell us a particularly sample size calculations, and what sample exactly needed for me. In this way, when they come to us, then it is very difficult to tell them, and it is not so easy to tell them exactly the what sample size do you have or what research design do you need. That is why the base journey of the research will start with a blue map or the blueprint of the research design. So I want to share you with my PPT. Is it visible to all?
Yes, madam.
Yes, ma'am.
Okay, thank you. So today we are discussing about the research design, which is a framework for the scientific inquiry. Without having a particular framework of the research proposal or the research synopsis, we cannot go for the scientific evidence of the thesis or the dissertation or the any of the research article. So we need to understand what exactly the types of the research or types of the research design, how we can apply this research design to the research proposal, and how we can use this research design as a best practice. When we come to know as a systematic review, or when we come to know as a meta-analysis, then at that time we understand that many of the papers are there or the articles are there, they are not using the best research design they can be applied. At that time, it is very difficult to understand the actual application of that particular research article. So basically, I choose this topic that before I have not chosen this topic. I have taken the lectures on the sample size calculations, sampling designs, data collection frameworks, and research proposal writings and all. But today I decided that we should talk about the research design because it is a very important framework for the research inquiry. So in the today's agenda, we are going to discuss about what is a research, what is a research design, what are the elements and characteristics, process of it, methods, and how we can classify the research. So before going for the session, some of the prerequisites are for this session is necessary. That how many types of variable is there, what are the data collection methods are there, sampling methods are there, or the process of the research is there. Everybody know about the what are the types of variables. Without having the proper types of variables, we cannot go ahead. So we know about that. What is a dependent variable or independent variable, intervening variable, confounding variable, moderating variable, major variable, or treatment variables. These are the basic things. Basic things we come to know. Whenever we have a framework of our dependent variable as well as how many independent variables, how many mediating or moderating variables are there, and on those base we can go for directly for the research design. That is why we can understand that either we are having the how many groups are there, what type of survey we need, what type of case studies I need. That all depends upon these dependent and independent variables. At the same times, we should be very clear with our data collection methods. That either I am using the questionnaire, I am using the case report format, or any qualitative or quantitative data I need. If a quantity data is there, then which the magnitude I am using. If the quality data is there, what is the rating scale is there, or the attitude scale is there, or the how exactly the inventory is going on. Similarly, the sampling methods is one of the part of the prerequisite of this particular session. So I understand that I hope so that these all things are covered to you or may be knowing to you. That's why we are going ahead. So first of all, in a simple language, we are discussing that it is a collection of information of data. Whenever a systematic investigation of hypothesis, maybe the inductive thinking, maybe the deductive thinking, with the hypothesis, we will go for the significant findings and in a very structured manner, that is we called as a research. Without the evidence, without the data analysis, without the findings, without the proper references, we cannot come to the any conclusion in the research. So what is the role of the researcher? This is the base that first of all we plan the research. In this planning, the analysis, design, implementation is there. Then we are preparing a system prototype. This system prototype is our research design. This system prototype will give you that how exactly your data analysis is there, finding conclusion is there, and then we are coming to the system. So role of the researcher is that how we can start with the planning of the research, what is the time frame of me, what is the design of the research, and how we can provide a system. Because every research is gone for the basically predictive type of the research. Wherever there is a prediction is there, the research is there. Without the prediction, we cannot go for the any type of innovative research. So this is the basic steps of the research. Just we say the waterfall development based on the methodology that first of all we plan the research, going for the analysis and the design or the new design or a new innovation will be there. Again, the implementation is there, and we are coming this research into the noble world, or maybe the into the system. Whenever any system will come, then it is a research priority. According to the research priority, we are going through the planning to the system. So we everybody know about this research process design. Whenever pre-production step is there, production step is there, and post-production step is there, we have come with a research idea or an innovation or a clue or a hinge. That is why we pick a topic is translated into the research question, and we this research question again into the hypothesis or the objective. So this is the base of the research, that the idea come up. Based on this research idea, we come to the research design, that we are using the research methodological approach. There is a difference between the methods of the research as well as the methodology of the research. So we are selecting a proper methodology approach for the variables. We define the variables and we find out the data collection procedures, and we determine the sample at the research design step. Then we are going to collect the data, a proper collection data of there. When data is collected, the analyzing the data is there, and we are writing the article or thesis or dissertation, and after the technical writing, we'll go for the publication process. But starting from the research idea to the publication process, whole is called as a research process design. So first of all, we need to understand what is the research design first of all. The base difference between is that research design is a different and sample design it is a different. Research design, it is made for the population design, and sample design is made for the actually the sample that we are going to select actually from the population. So overall plan or structure that guides the processing, conducting research, and the critical component of each process, each sampling variable, each data collection, and we are giving a blueprint of it. And this blueprint, it is called as a research design. So the blueprint, it is for the collection of sample, measurement of the sample, measurement of the data collection, quantitative, qualitative data collection, and analysis of the data. This all we are planning with the research design, and different types of research designs are available with us. Now, what is a research design? If you can't describe what you are doing as a process, you don't know what you are doing. As a good plan, it is like a roadmap. It shows that actual final destination, usually the best way to get it there. Whenever we know that what is my destination, what should be my results, or what should be my hypothesis, what should be my conclusion at the end, then we can plan it properly. Otherwise, we cannot plan the research over there. And without planning, we cannot go everywhere. A simple story I always tell to my every student of the PhD scholar, that a simple thing is that there are in a barren land, there is a big tree. On that particular tree, two persons are sitting over there. One person is sitting at the bottom of the tree, but the other person is sitting at the top of the tree. Both are waiting for a car that they should move from there. But the thing is that a person who is sitting at the top of the tree said that in the next half an hour, the car will come and it will take us away. So a person who is sitting at the bottom of the tree, he said that I didn't see any car which is coming over here. But are you an astrologer? Can you saying us things in a predictions? So a person doesn't said anything. But after half an hour, a person who is sitting at the top just come down. Just come down, and a car has been come, and both the persons are go away. The thing is that the research plan or the research design, it is that thing, it is your vision. A simple story is that a person who is sitting at the bottom can see only for the 5 to 10 meters away. But the person who is at the top, who has that particular vision of 200 to 500 meters long. In this way, suppose if we know that what exactly the roadmap or how we can go ahead or how we can move ahead, then it is a very easy to go with our research designs. So basically this research design, it is a very important. So research design will go, how it will go with the research objectives. First of all, whenever I come to an idea, I am going there to frame one of the title. Title will show you that what are my research objectives and my research outcome is there. But we should move from the objective to the outcome through the research design. This research design I need to understand in each way. So this is a research design. It is, we call it as an instrument, or it is an information, or it is a target helmet. This helmet is there. It is very easy to go for the research outcome. So this is the way the research design, it is a tool or a map or a blueprint or a structure, and that will lead to our fulfilling the objectives as well as a fulfilling of the hypothesis. So what is the benefits to understand the research designs? First of all, it will give us a very clear directions. That is a direction for the clear objectives, and the specific research is very necessary. And whenever we are going for the objective and hypothesis, with the title itself, I come to know that what is my research design. Second thing is that whenever there is a standard protocol, that is, we call it as a p-value. Everybody know the value of the p-value everywhere, but the basic understanding of the p-value is that is to only compare with the best. It is the compare with the standard values, or it is a comparison to experimental variables to the some standard values. Then it is very possible to find out the p-values. I will say you to the simple example that a person or a student, something person, Shirish, he got a mark 85. He is getting a mark 85. Does that mean that he has 85% or 85 anything? Because we are comparing that 85 with the marks of the 100. Then that 100 marks is my p-value. 100 marks is my p-value. I'm comparing that 85 to the 100 as a p-value. That is why we are saying that a person got a value of 85%. Or suppose in the next exam, he will get a 90%. Then I can say that there is an increase of 5% according to the p-value 100. Because p-value, it is a standard, and we are supposing or proposing such a controls in the research designs. Whenever we have that controls, then the research design, it is a very strong research designs. So we are going to discuss about the weak research design and the strong research design afterwards. But you understand what do you mean by control? The control variables are that the control variables are those variables, those are giving you the standard values to compare. Whenever we are in the research design, we are comparing such a things, then it is very beneficial to the researcher as well as to the user or the researcher, that to eliminate the factors of the mediating or moderating variables, as well as they need to identify the potential of confounding factors, that what is a controlling factor to my research. And that is why we are using a simple word which is called as a randomization. The use of randomization, it is to minimize bias. I want to explain you that what exactly the randomization. A simple word is there. Normally we will take it as a simple thing, as a sample is randomly selected. It is over there. Sample is randomly selected. This one. But actually the randomization leads to the 5 things. I say a sample is randomly selected. I say the sample is a replicable. That means wherever the study is there, we can repeat the study any times. As per the environmental criteria, as per the locations, as per the geographical locations, we can replicate the data. We can take a multi-centric sample clinical trials. It is a replication. Again, the sample is a repetitive. It will give you the certain conditions as a local control, and the randomization will lead to the minimum bias. So considering this definition of the randomization, we'll go for the minimum bias and measure the more and more reliability with the research designs. So the replication, that is a well-chosen research design, will eliminate the biases and errors anywhere in the world the design is experimental or taken the clinical trials, or anywhere the experiment has been designed, then also it is a fulfill. So the next design, it is a validity, reliability, and efficacy. We need a perfect results. We need a reliable results. We need a normality of the results, and we should understand that the data should be a very effective one also. So this is some of the examples that can you explain me that which research design is applicable to these examples? Just a little small exercise is here. Enhancing cardiovascular disease prediction through the optimized deep learning techniques using the customized Java algorithm approach. Which research design will it is applicable? Can anybody tell me? Just seeing by the title of the research. Yes, anybody? Any of the 5 titles I have given here? Exploratory study of financial literacy among the junior college students in a Pune city. Which research design is applicable? Analytical study of geometric function theory. Okay, I think you are
For
new to this.
uh,
Yes.
the first one
Yes.
could be the cause and effect. Could be, might be, I'm wrong. And the third and fourth, it could be the exploratory research where we are going to explore something new.
And I'm talking about research design, ma'am.
Okay.
This is the exploratory research. I agree with you. But the
Okay.
what the research design we are implementing over here? It is a descriptive, it is analytical, it is experimental. Which research design?
Financial literacy, descriptive research among the.
Yes, descriptive research or a cross-sectional research we can apply over here.
Yeah.
Analytical study.
The first one could be the ma'am longitudinal
No,
enhancing.
no, it is a correlational, as you said previously.
Okay. Okay. Okay.
It's a correlational. It is a cause-effect relationship.
Okay.
Huh. Okay, we'll go ahead and we'll see that how many types of research designs are there and which is applicable to which. Okay, these are the 5 sections. At the end also, we are discussing about these 5 research titles. Okay. So what are the elements of the research design? It should be a very accurate. We are implementing for the collecting and analyzing the results. Types of methodology is clear, and the timeline is it is an important part in the research design. And again, the measurement of the data analysis, that how the data is collected in a proper way with the proper research designs. Okay, so this is some characteristics of the research design, that it is a neutrality. What do you mean by neutrality? It may happen that one of the online survey of the students can be implemented by the 4 researchers. But these 4 researchers can use the different research designs. One researcher's taken the survey design, one researcher's take the cross-sectional design, the third researchers take the quasi-experimental design, and the fourth one is taken the any randomized control design. But all the 4 should give us the same results. Is it possible? Is it possible?
No, ma'am.
No, it is not at all possible. Because as per the research design changes, the results are also changes. So we cannot compare that this is good and this is bad. Because for every research design, the testing of hypothesis applied to everybody, it is totally different. So we are choosing such a one research design that is which is giving a neutral results to us or to the researcher. That is why it is very important that how to choose a proper research design for our research. Second one, reliability. Reliability, that means accuracy. Accuracy, how I come to know that my results are reliable or the valid or the generalized. This process will come through the systematic review of literature. Whenever we go for the systematic review of literature, we are going there for the systematic review of literature with a meta-analysis. Then I come to know that which research design it is a very, very reliable or valid. But normally the things are there whenever I have taken a comparative studies or the control studies are over there, then the results are very reliable, valid and generalized. But the thing is that whenever I want to stand up a baseline research means suppose a particular disease has don't have a prevalence. I need to find a prevalence of that particular disease, then it is a baseline study. Then whenever the baseline study is there, we are always using the cross-sectional research designs. So in this way, wherever these all the characteristics is applicable, that research design we are going to study in the research design. So what is the process of it? First of all, we consider the title. We decide what is my exactly the aim, what is my objectives. We are going to find that what is my population over there, by which sampling method I'm going to take a sample. Either it is a simple random, either it is a stratified, either it is a cluster, or either it is a multi-stage. At that which sampling method, because according to the sampling method, choosing the research design is also changing. Then we are choosing the data collection methods. Either my data is a qualitative, either my data is a quantitative. My data is a quantitative, and in which measurement tool I'm going to use it. My data is a qualitative, then which scale I'm going to collect it for the data. Then I am going to plan my data collection procedures, and we are going to plan our data analysis strategies, and then we are going through the research designs. So what are the research design methods are there? These are some of the methods that you are seeing in my diagram. That first of all, research design, it may be the quantitative or it may be the qualitative, a simple bifurcation. A simple bifurcation will go to the quantitative or it is a qualitative. Suppose the quantitative is there, then it may happen in a two ways. Either it is a non-experimental or it is a experimental. Non-experimental research designs are the descriptive, comparative, correlational, survey, X-factor research, or descriptive studies of the research. This is all non-experimental research because we are going through the finding out the facts and findings in the data. So these are all the non-experimental. The experimental research designs are the true, quasi, or the pre-experimental or pre-laboratory experimental, which is the pre-experimental. Then some of the mixed methods are there. That is the exploratory or the triangulation. Triangulation means we are using the multicentric data, collecting the multicentric data and going for the research design. Triangulation, exploratory, that means it will cover the three things. It will cover the case study method, it will cover the interview method, then it will cover the questionnaire methods. Three things together, that is the data collection procedures, are the three things together, it is exploratory. Or it may be the explanatory, that what exactly the data by the cause effect relationships. But we can use the qualitative and quantitative method mixed in the mixed methods. But we are coming to the qualitative research methods, then it may be the ethnographic, it may be the phenomenologic, or it is a case study or a grounding theory or a case series or radical studies are there. And the qualitative studies are there with the concept analysis or the historical analysis, that we are called it as a prospective studies or the retrospective studies. These are may be having the different names in the different books, but this is a major a map that how we are going through the research designs. So one by one, we are going to understand how the research designs will go. So these are the some of the mixed methods that are convergent parallel designs are there. Suppose a quantitative data collection and analysis is there and qualitative data collection is there, then two things are there. Either we are going to compare it or we are going to relate it. How we are going to relate it? By the correlation or by the association. Then the things are there. A simple way you can understand. Suppose the two variables are there as a quantity variables are there, then they can correlate. We can correlate the variable. Suppose the two variables are there, quality variable, then we can associate the variable. But suppose such a variables are there, that is a dependent variable is a quality variable and independent variables are the quantity variables, then it is difficult to have the association or correlation directly. Then it may be having some divergence in between them. Suppose this happens that the dependent variable, it is a quantity and independent variables are the quality parameters. Take an example of the diabetes. The HbA1c value, it is a dependent variable. But this dependent variable is depends upon so many independent variable. That is a parameters of all the diabetes. This is a paper that this is the variables that we cannot directly compare or directly correlate with the quantity variable to the quality variable. But still, in the statistical methods, what we are doing that we are converting the quality variables into the quantity variables, and we are really keeping the associations in between them, and we are come to the conclusion for the interpretations. So this is a convergent parallel designs, and we need to study about what exactly the research design will be applicable for this. So sometimes what happens, the quantitative data collection analysis is there, but the follow-up with the again quantitative data collection, and we are going for the interpretations. Follow-up is over there. Again, quantitative data collection built up to the, again the things are there. Sometimes quantitative variables need the further explanations is over there, or some of the things are there. We are developing a new instrument or the new models, which is a totally deductive researches are there. What do you mean by inductive and deductive? Inductive research means already a theory is established by someone. A theory is established by the researcher or a theory is established by the scientist, and just we are going to evaluate it. Either the theory is right or wrong, or either it gives the same results or not. This is the inductive reasoning, inductive reasoning research design. But the second thing is that sometimes what happened, a particular doctor is there and so many times he is giving the medicines to the particular patients with a certain combinations. But one patient is cured with that combination, second patient is cured, third patient is cured, and after the 10 to 15 patients, he come to know that this particular medicine is applicable with that combination of the drugs. Then that combination of the drugs, how it will work on that particular disease is a research, and which is called as a deductive thinking. And after that, he developed a new model or a new medicine for the same disease other than the different medicine, which is already existing in the market. But such a research, which is we call it as a deductive thinking or the deductive method of the thinking. But such a all designs, it is called as a particularly mixed methods of the quality and quantity variables, quality and quantity dependent, independent variables, which is called as a mixed methods of the study. But in base, to understand the base thing of the research design, will come to with the 5 designs. One is a descriptive, second is a experimental, third one is a correlational, fourth one is a diagnostic, and fifth is a explanatory. This is a basic research designs that we are come to know that in this majority of the researches or majority of the research proposals will lie in between these designs. But whenever we go for a little broader scope of it, a little broader scope of this research, then all the epidemic researches or all the studies will come under this basic things are there. We have been seeing that descriptive, analytical, experimental. But whenever we come to the descriptive research design, it will start with a case report, a single case study. Suppose I want to study a zero entrepreneur. Then that particular zero entrepreneur may be the one of the case study. Previously, in 2015, I met one entrepreneur who is a Mr. Mahabad in the Sangli MIDC. And I went to him that he has been started his business from the zero, literally from the zero with no money. And now he has a business turnover near about the 1200 crores, etc. That is why I want to study about that, how a person can build a business with a zero to a great entrepreneur, unicorn business. It's a case study that how any business can be a unicorn business. It's a case report. It's a case study. So in this way, a single case study or a single thing can be go with a descriptive study research. Other one is a case series, that 10 to 15 cases are sufficient to establish your research. 10 to 15 cases only are there, but that will say you that how the things will go. Some of the incidents are there, cross-sectional studies are there, but this is a general map, that in this general map we are going to one by one and understand that which applications or which researches lie into which experimental studies or which research designs we can explain it. Some of the things are analytical, but when we go for the experimental studies, again the clinical trials are there or the observational studies are there, like a cohorts are there, prospective, retrospective results are there. This is all that we need to understand. This is a base map things are there. That the previous map, research design, descriptive, experimental, correlational, diagnostic, explanatory, and in this, these are the sub points, sub sections of it. That these all we are going to study under the research design. So first of all, we will start with the descriptive research design. Till now, do you have any question or shall we go ahead?
Ma'am, I have one question.
Yes, ma'am.
Ma'am, when you talk about two things, that is the neutrality and the second is reliability.
Yes.
Uh, as per my previous knowledge, it could be wrong. Under the reliability, we check the consistency of result. Like every time we need to have same result, but the same thing you talk about the neutrality. Like we are going to have the same result with the different tools.
Yes, ma'am.
So can you differentiate what is the like exactly difference between these two terms?
The thing is that whenever we are, reliability means majority of the reliability will go with the accuracy, ma'am. Accuracy thing, accuracy, reliability, validity, and precision are the three things. The reliability, validity, and precision are the three things, how it will come up. In a statistical way, all the parameters are measured with a mean and standard deviations. Okay.
Okay.
The average value will go said you as a mean. Okay. Whenever the data points are there or the sample points are there, they are scattered in the data or having the variability in it, that is a higher standard deviations are then it is not a precise. The validity is not there in the data. But when the standard deviations are very less and the average, they are near about to the average, then we are saying that the data is a reliable or the valid data is there. Why it is so? Because the variations or the deviations in the data, deviations in the sample data is a less. Take an example that suppose there is a marks of the 100 marks is there. Okay, the two subjects are there. Those are having the 100 marks. But in these two subjects, it may happen that one of the student is having the 50-50 marks. Exam is of the 50 marks. Other paper of the 50 marks. 50-50, 100. But one of the major things is that some of the student has the, in one paper he is a 0 mark and other paper he is having the 100 marks. In this way, the consistency of the data that will deviate from the mean. The deviation from the mean, it is a greater, the data is not reliable. The data is not accurate. We are talking about the accuracy of the data and the validity of the data. The majorly, whenever the data is a centrally together gathered, the data is there and the deviations are the less or the variability is less in the data, then we'll come to as a consistency of the data. Whenever the consistency is a more, the normality of the data will lead to the higher precisions. And that is why the reliability is a more at that time. But whenever we come to the neutrality, what will happen? The many different, the same example I will take of the diabetes. Okay. In the one multi-center, one of the central, like take an example of the anemia. Okay. In the one laboratory, I will find out the one result in for the anemia, HB value. In the other center, in the other laboratory, I will having the HP value in other way. In the third laboratory, I will having the third value of A. But the thing is that when I check all the patients, it may be multicentric, but at the same laboratory. Take an example of the Lal Path. In the Lal Path laboratory, I have taken the samples from Kolhapur, I have taken the samples from Pune, or I have taken the samples from Bombay. But the laboratory is the same. The calibration and standardization of the laboratory, it is the same. Then I will get a neutral results from all of the multicentric patients. In this way, whenever I frame a research design, I will find out the neutrality in the research designs. That is why the framing of the research design, that is the sample data collection, how it should be, from which geographical area it should be, or what is the sampling method, what the sampling method should I use, that should be very clear to set up the neutrality of the data.
Okay, ma'am. Now it's clear.
Clear? Okay. Thank you, ma'am.
Thank you, ma'am.
Anybody has any question? So we'll go ahead with the descriptive research. The descriptive research, it is a type of research which describe the population situation. The simple thing is that descriptive means to find the facts and findings. Simple, facts and findings. Why I need these facts and findings is the base. Suppose I don't have any facts and findings of the current data or the past data. Without having the past data or the current data, I cannot predict for the future. The simple thing is that whenever I have that, suppose I take a simple example of the descriptive research as I need to prepare a vaccinations for the year 2028. But to prepare the vaccination for the year 2028, because to prepare one vaccination, it will take a 2 years data, or it may be having the 2 years, 1.5 years process to prepare one vaccine. To that preparation of one vaccine of the 1.5 year, I should take the data of the past as well as the present. Then only it is possible to prepare the vaccination in the 2028. Okay, I will give you another example. 5 years back, what is the price rate of the gold? It is a 60,000 rupees, near about 60 to 60,000 rupees. 5 years back. At that time, government has given the gold bonds. They started at that time to give the gold bonds. At that time, what they decided, or what is the strategy behind it? The gold rates will not expand so long, or it will not raise other than 10%. ऐसा उनका स्टडी था that it will not rise. The rise of the gold bond should not be there in up to the 10% only. This is the government data that said that it will not raise by the 10%. But the facts and findings says that the value price money of that particular gold has been increased to nowadays to the 88,000 or 90,000 rupees. From the 60,000, it will come to the 90,000, and a sudden great growth of the price money is over there in the gold bonds. With this high price or highest high price, what happened? The government is come up with a near about 128 million crore rupees loss. Have you seen that video on YouTube? I don't know. But this is the things that how the descriptive research will come. At the 6 months back, when the gold is at the 80,000 rupees, then also everybody is saying that we will wait for the gold, that the prices of the gold will come down. But it does not happen, because whatever the international markets are saying, as per the international market, the value of the gold should be increasing at that time. Now, it is a current data that the government has come into the loss because of this gold bonds. Okay, and that is why this descriptive research is very necessary to understand what exactly the situations, what exactly the phenomena, what exactly the process, and how it will be with a particularly give the certain questions or the problems. Okay, that is why understanding the facts and findings in the current data, it is very important, because it will lead to a behavioral patterns. It will lead to a certain what I say, the modeling of the data, or giving a certain distribution of the data, and that distribution has to be analyzed with the only statistical analysis, with the descriptive research only. So that is why this particularly based descriptive research design has to be covered up. So descriptive research, it is a type of research that I already told you that how, what, when, and where, and why. Okay, normally we have research questions, problems will come up with the why. What is the evidence? Why this has happened? How this has happened? How there is an increase or decrease in the data? This will come up with the research problems. But in the descriptive research designs, we are studying about the current situations, facts and findings, past situations, facts and findings, how the things are changed in the data, and how the patterns or the variables will behave in the future also. That we need to understand in the research design of the descriptive findings. So research design, it will go with the who, where, and why, when, in relation with the what. That is the outcome. That will be the outcome of the study. A person, age, sex, occupation of the individuals affected by the outcome. How the demographic characters are there, that will affect by the outcome. That what should be the outcome of that. Places, geographically, incidents, workplaces, hospitals may be affected by the individuals. You see the data by the 10 years back, the interior designers are having no works. They have the works, but it is not so great work that they are doing. But see the fashion trend or the actual trend of the infrastructure nowadays, then you can understand that hospitals have also having the great infrastructures. Why it is so? Because of the data, current data. So the time that the events, diagnosis or the reporting or the testing has been occurred. So such a research design is there, that how the facts and findings will lead to the future contents or the future behavior, or the predictive data is there, or the what I say, the future parameters are there, that will be said by the research design, which is called as a descriptive research design. So normally what happen in the particularly collecting information? Collecting information about what? Without worrying about the why. Just collect the information and give the actual data or a factual data to give the prospective values. So one of the travel agency there, here I have given that one of the example, that one of the travel agency is there. Okay, what is the work of the travel agency? That will collect they will plan the trip, and they will come up with the people, and they will get a benefit of it. But they are collecting what the travelers' favorite travel of the destinations. What are the preferred accommodations are there? What are the activities they do enjoy? And they are not worrying about the what is the traveler's favorite travel destination. Why they prefer these accommodations? Why they enjoy their activities? Yes, the basic things are there, which is maybe the non-tangible. Those are maybe having the quality parameters, but those are the confounding variables. That confounding variables actually affecting upon our dependent variable and independent variable. That is why whenever the travel agency is there, we are studying about the travel agency, but the collecting the facts and findings of the data will lead to answer such a questions. And that questions are very important over here, but because that will lead to your future travel agencies prospects. That is why this data is there to studying about the facts and findings in the data. It's a descriptive research. So why to use the descriptive research design? Basically, that to measure the data trends. Trends means to future. Data trends, it may be increasing trend, or maybe decreasing trend, or it may be constant, or it may be having the things are that. Take an example of one of the company that has been closed down. कौन सा company था? Tupperware. Okay, the Tupperware. The company has been prepared a product of the Tupperware, which is a very potential. Any person who is purchasing the Tupperware instruments or the Tupperware apparatus, they don't need to purchase it for the next 2 to 3 years or the 5 years. Then, if there is a no sale at all for your products, then who will purchase it? एक बार जो बना दिया प्रोडक्ट वो 5 साल चलता है, 6 साल चलता है, तो there is no need to purchase it again. So it has a decreasing trend. It has actually the products are very nice, very good. They're quality products, they're branded products, but still the company is at the decreasing trend. How it happens? It will happen with to study the descriptive research. So this need to understand what is the trend, data trends are there. Second one, comparison is there, that how different demographic persons or how the different demographics are responding to a dependent variable, and validate the existing conditions also, that how the existing conditions will prepare a certain patterns in the research object and the conducted over time. It is also with certain changes at each point of the time. So this is why the descriptive research designs are there. Here is one another research design which is called as a comparative descriptive research design. This is the design where researcher considers the two groups of the variables. Two groups, compare the facts and findings of the two groups. Take a simple example that we are caring about the nurse station. Okay, nurses station is there. But we take a two hospitals, and in the one hospital ICU's nurse station, in the another hospital the ICU nurse station. One ICU is running and flowing, and other ICU, other nurse station is not having any response. Why this has happened? Because of the study of that particular care that the nurses has been given. Actually, the training of the nurses is the same everywhere. Training is the same. The protocol is the same. The SOPs are the same. The SOPs are given to the nurses on the same SOP. They need to work. But still, some of the hospitals are good running and some of the hospitals are not, because of this patient's care. Whenever we take the patient's feedback from both the hospitals, then we come to know that what happened, that one of the hospital is flowing with the patient and the other one is, which is the better and which is the less. It will have the significant difference, that it will come with a comparative descriptive research designs. Here is one of the example that I have given. A researcher wishes to conduct a study on internet usage of the English teachers using the railroad trick and the content-based approaches to the Bachelor of Computer Technology students. Comparison is there. Facts are there, but with the facts, whenever we are going to compare, then it will be more applicable. Research is there. Or a second, third is a descriptive study of the childhood obesity monitoring practices used by the pediatricians. This is the one of the example which is called as a comparative descriptive study. Now the next research design which we call as a cross-sectional research design. Cross-sectional, this is a very important research design as a cross-sectional research design. The thing is that many times what happen, in the research design, we need to take a follow-up of the patients, or we need to take a follow-up of the programs. Take a simple example, that I have taken a one lecture of the research methodology to writing a research proposal. Okay, each and every sub point I have make you very clear, and I told you to write a one research proposal on the online data of the social things. Okay, but after 1 month, there is a, I have not taken any follow-up. Then you may be forgot about that what I have told. After 1 month, again I have taken the follow-up, that either you have written the research proposal or not. What is the actual condition of that research proposal? After that, again after the 1 month, I have taken the follow-up. Then after the 3 months, I come to know that my lecture or my training has a no worth at all. Why it is so? Because it is very necessary that there is something association between the first follow-up and the last follow-up. There is always association, and this is the cross-sectional research designs, that it may be a differences between the 5-year-old, 10-year-old, 15-year-old in the experimental run. Sometimes we need to take a cross-sectional research. Take a simple example that a person has a fever. Okay, in the month of January he has a fever, and every 6 months he has a fever. It is very natural that any person have a fever. Simple things are there. But a person is having the pattern of the fever and fever and fever, then it may be cross-sectional research designs. Then we need to take a follow-up with a certain gaps. And in the certain gaps, we'll follow that what is a before study, what will happen in the before study. Like a same example in the, suppose there is a, what are the marks in the test 1, what are the marks in test 2, what are the marks in test 2. Either a student is taken the particularly a follow-up assignments are there, and what are their end same examination. At the final exam, are they studied good? Cross-sectional research design. Cross-sectional research designs is there. It is always possible that this cross-sectional research design will take to prepare a baseline data. I already told you about the baseline data. What is a baseline data is there? Baseline data is there that to find out the what is the incident rate of the events or the facts, or what is the prevalence rate of the rate of the events of that. Suppose I predicted one a theoretical that nowadays after the 35 there is a higher risk to have the thyroid patients. This is a hypothetical statement, but I need to prove this hypothetical statement with a cross-sectional research design. Why it is so? Because above the 35, it may be male, it may be female, it may be the any demographic features are there. With that demographic features, I need to take a survey of the people. I need to prepare a case report formats of there, and I need to find the diagnostic research that either after the 35, how many majority people are there, they are having the thyroid. In comparison with the previous data that the thyroid patients are come up above the 45. With the comparison also, I come to know that there will be the patient in the cross-sectional research design. In this way, when I need to do the patterns of the study or follow-up of the studies within the different intervals, then I will go for the cross-sectional research and to find out the baseline data. Baseline data. Sometimes what happened, there is a no baseline data. Baseline data means जैसे कि we have decided that 35 is my passing mark. Who has decided that 35 is a passing mark? Nobody has decided. Okay, but the longitudinal study of the educational patterns says that it is a 35, it is my baseline data. Somebody can take a 50 as a baseline data, take a medical example, then 50% it is a baseline data of them. But in a normal education pattern, 35% it is a baseline data. But in a medical pattern, it is 50% it is a baseline data. Then who has decided that? The studies of the students decided that there should be a 50% passing should be there, that at least 50% knowledge or 50% gain of the marks, it is a minimum requirement of the medical students. This is a baseline, and that baseline such a researchers will come up with a cross-sectional research designs. So what is a cross-sectional research design? So this is that I have given in here the 4 options. Then which is the cross-sectional research design? Just read one. A comparison of 2 or more variables longitudinally, or a design that devised with a researcher in a bad mood, or collection of data from more than one case at a moment in a time, or research of one particular section of the society in the middle classes. Which is a cross-sectional research design?
A is the correct answer.
Yes, A is the correct answer. Comparison of 2 or more variables longitudinally. A long term, in the time period, we need to collect the data. In the time period. That time period is very important over here in the cross-sectional data. So we'll come up with a longitudinal study design. Basically the word longitudinal, it will say that it will go for the long years. Long years means how many? Long years means how many? How many? Near about 5 to 10 years. Near about 5 to 10 years. Take a simple example that we launched a satellite on a Mars. It is a longitudinal study of the 50 years. 50 years studies. Suppose there is a particular project about any uh, fusion or any power reactors. Longitudinal study. It will go for the longitudinal because the fuel is going down nowadays. We can't come up with the fuels with the oils, petrol, diesel, kerosene. It is not possible. That there should be a new other ways to find out the fuel for the people. Then it is a longitudinal study. Take a study of the cancer. It is again the longitudinal study. So many years, 50, 45 years, 10 years, 20 years, the studies are going on. And this study will say that how many years the study will do. In the one way, smoking causes cancer. एक दिन में नहीं आया. एक दिन में नहीं आया वो. How many years of study is there? Because there is a centric study of the cancers all over the world. International platforms are there which are collecting the data from all over the world, and they are coming with a rare cancers and very common cancers, and the data cancer is come up with a one international platform, and that will go to the again the further studies. That is why whenever a group of people or a multiple group of people studied in the multiple intervals, in the multicentric data, and with a particularly a long time period, maybe weeks, months, years, and they're taking the researches of that, and which we call it as a longitudinal study. So, for example, longitudinal study of the Facebook, LinkedIn, and Twitter and YouTube. Okay, what is the generation of the Facebook? How many years it has? How many years of the LinkedIn has or Twitter has? It will go for the longitudinal. How it will change with the evaluations? How it will change with the evaluations? Evaluation is a particular part. Okay, nowadays we come up with the genetic studies that nowadays adolescent girls has the menses. Okay, adolescent girls has a menses. Maybe whatever the reasons are there, whatever the many reasons are there of the diets and all other things, but it is an evaluation of the nature. Evaluation of the nature will come up. Menses will start at the age of the 8 to 10 years to the adolescents. The little girls are there, but the menopause will come up to the 40s, and they need to leave their life totally to the 70, 80 years. Then you can understand or you can think about that how many years infertile years are they have, the girls have. That is why their fertile period is a very less. That leads to the test tube babies. That leads to the other problems and other problems. But I saw one movie on Netflix, which name is a Joy. Okay, you can see also the name is a Joy, but it is a research about the first test tube baby. How the first test tube baby and what is the idea behind it. Dr. Brown was there in that particular movie, and he was talking about that if a one can be fertile in a Philippines tube, it can be fertile in any other test tube. A simple thought behind it, but at that time it was very unethical. If you see the movie, then we can easily understand how the unethical studies are going on this way. We are also having a depression to see the movie, but nowadays it is very common to have a test tube baby. Longitudinal study design, so many years. It is a case of 1972, I think so. The first test tube baby has been born, and now the era of the 2025. Just 40 years, 30, 40 years are there. But in these 30, 40 years, how the data has been evaluated, and how the at that time the particularly microscopes, higher power microscopes are not there. It is very difficult to extract the ovum from the uterus. So many problems are there, but whenever the studies are going on, maybe longitudinal study designs are there, and that's why we are collecting the information in such a way. It is normally not possible to study in the thesis or in the dissertation or writing the research article, the longitudinal study. But we can be a part of it. Dr. Brown has published every research paper which is a failure of the test tube baby. And that is a very good, what is the contribution of that Dr. Brown? Because writing the failurity of the research article, it is a part of that longitudinal study designs. Because collecting all those research articles, the data will come up and evaluated, and now it is very easy to study about the things. So this is very important to have the longitudinal studies, because it may happen that your thesis may be of the 3 years or the 4 years, or the dissertation may be 3-4 years, but it may happen that the study will lead to the again next longitudinal study of the 5 to 10 years. Okay. Now there is a next one, a correlational study designs. This particularly correlation study designs, it will come up with a, about that a cause and effect relationship is there. Where there is a cause, there is an effect, and where there is an effect, there may be the cause. Corona is there. Corona is the effect.
I don't understand.
Corona is there. Corona is the effect. Then what is the cause of it? So many movies have been come up with the causes of that particular corona. But the correlational things are existing. Simple, I already told you that correlational things are there. Simple thing is that we'll talk about the BMI and obesity. BMI, it is a quantity variable, and obesity, it is a quality variable. Quantity variable of the BMI says that the BMI value greater than 35 will lead to the high obesity. Okay, but the BMI, it is a quantity variable, and obesity is a quality variable. But BMI will be calculated with the parameters or the variables height and weight. Height is measured, weight is measured, then BMI is calculated. So the obesity, it is a maybe the outcome variable, it is a quality variable, but it depends upon the two independent variables, height and weight. So what is the effect? Obesity is the effect. What is the cause? Height and weight, it is a cause? No, it is not a cause at all. It may be cause of the diet, it may be cause of the stress, it may be cause of the other moderating and mediating variables are there, or maybe the confounding variables are there. Then I need to find out that what exactly these mediating and moderating variables are affecting as a cause to the outcome variable to the obesity. And that is very important. That is why whenever a research design is there or experimental research designs are there, it is a impact of that cause and effect relationship. It may happen that for every dependent variable, there may be independent variable or not independent variable. But it may happen that some variables are there, they are directly affecting on the dependent variable or independent variable are there. I will tell you the simple correlational study design, one of the correlational study design, that every time we go to the supermarket, okay, and we see the things or the objects are placed in a certain manner. Okay. Are there any significant correlation between those places or those patterns, that how they are displayed the things over there? How they are displayed the things over there? Okay, simple thing is there that we entered into that right hand side, some things are there, right hand side things are there. But there is a one study which is covered with a SAS company, SAS multinational company, that the study says that when there is a shelf of the drinks or the beer, then at the nearest to that particular shelf, there is only the baby products. And the correlation between placing the baby products near to the beer racks, it is highly significant. It may be highly significant to the 90 to 95%. Now, what is the correlation in between this? Actually, there is no research design at all, but the things of that the correlation is existing over there, that how the patterns or how the distribution or how the behavior of these all displaying the just the patterns things, it is there and it has a significant correlation. They have been studied a lot, that on which rack which things should be placed. It is a cause effect. Naturally, the cause effect, It is a what you say, that it is a tempting things. But that tempting, that psychology, that behavior pattern, it is a arrivity that will be a very observational, and it is a main thing of the data collection. But in the correlation designs, is there a control is available? No, there is no control available. See that there is a no control available. That the two variables has significant correlation, it can be used for the predictions. It can be used for the exposure, non-exposure things. But it is a not, cannot be controlled with any control or standard variables. Standard variable in a correlation, you know that the correlation is highly lies between the -1 and +1. So there is a no control variables are there. The focus is for the observing the relationships in the data, observing the associations in the data. That is why it may be the Carl Pearson correlation coefficient, or it may be Spearman's, or it may be having the multinomial correlations are there. Many variables are there, they may be related to the many variables. But this type correlation study types are the predictive study designs, or a model testing study designs, or a descriptive correlation study designs. These are the correlations, different study designs are there. So the next one, predictive study design. The simply I have already told you, whenever the variables are or the finding the study design that are having the highly significant to the each other, then it will lead to directly the prediction of the variable, and that variables are very important. I will give the simple example that you will understand what is a predictive study design. Okay, take an example of any share. Take a NPO, any share that is a something XYZ company is there. Whenever the IPO opens, it is of the 10 rupees. But in the way that suppose is this particular 10 rupees and the IPO has been opened and it follows the patterns of higher high. And its index of the ESI, it is a higher. Then higher high. It may happen that all the pharma shares will go up to the higher high patterns, and it will predict that after the some years this particular share is having the great value. It may happen that it is a predictive study designs, may be qualitative, may be quantitative, but those will depend upon the predictive study designs. That is very important. This is also the one of the part of the correlational study designs. That correlation, the using the take a simple example that 2G will come, 3G will come, 4G has come, 5G has been come, then what will happen next? This is the predictions, and this may happen. AI will come, and this will happen to the next. This variables has to be predicted previously. Somebody has predicted this. Somebody has predicted. It is not possible to, without the correlation, without the high degree correlation, or without having correlational study designs, we will go for the predictive study designs. So this is a predictive study designs. Model testing study designs determines the accuracy of the hypothetical theoretical model. Hypothetical correlation is there, but are we preparing the model, and are the models is giving the real predictive values? That is a model testing study designs are there. That model testing study designs will again come up with a correlation study designs, and endogenous, exogenous, residual variables are the variables, and predictive model, those are the testing variables. Those testing variables will detect the things that either it will go for the long or it will not tested by the things. Market की बात नहीं है. A particular thing is there and it is tested by the properly. It is a model testing study designs. So here we come up with again experimental study designs. ये चार्ट में हमने क्या क्या बनाया अभी आप देख लो. That descriptive we have been discussed, case report we have been discussed, case series we discussed, incidents we are discussed. Incidents means a sudden occurring of any researches. Cross-section study designs we have discussed. Then what is ecological study designs? Ecological study designs, it will come up with uh, a behavioral studies of the people, which is called as a ethnographic. We'll take a simple example that you will understand how the ethnographic or the ecological study designs will go. Take a simple example that we are using the WhatsApp. Okay, everybody using the WhatsApp. But whenever I see the emojis of the WhatsApp, then the simple perception will come into my mind that these emojis are for the that expressing your things or the culture or the things. But whenever the 2 years back's WhatsApp emojis, see the difference between the 2 years back WhatsApp emojis and the current WhatsApp emojis. As per the objective, you can find out the gender equality in the WhatsApp emojis. They are finding there a lady teacher, a gents teacher, a lady doctor, a gents doctor, a lady sportsman, a male sportsman. Okay. Any career or any profession you choose in the WhatsApp, will find the two emojis for it. Why it is so? Because the gender equality or the equality, it is a current trend. Okay. How this equality will come? It came from the G20. That 5 years back, the objective of the G20 has been developed. And that objective of the G20 will say that there is a gender equality in all over the world. And that will come up with a simple emojis in the ecological studies. And that will implemented by the researchers. And such a studies, which is called as a ethnographic also. Sometimes ethnographic studies or ecological studies, that will studies will say you that how a people's behavior will change, culture will change, how the culture will change, how the patterns will change, how the events like a Deepavali or anything that ceremonies, marriage ceremonies, that how will it come up. Take a simple example of the any marriage ceremony. 10 years back, how the marriages it was, and now how the marriages it is. Take a difference of this. A cultural difference is there. Previously, the marriage will be for the 1 day, but nowadays it marriage will be for the 3 to 4 days. Why these cultural differences has been come with a global world? It is an ecological study. वही है, marriages वही है, लोग भी वही है, patterns भी वही है, but this something has been changed, and that changing values or the changing variables, changing ecology, changing ethnographics, variables will come up under these studies, which is called as the ecological studies. Take an example of environmental biodiversity. Biodiversity का example ले लीजिए. Biodiversity, what do you mean by biodiversity? That a particular pond is there, then all the living organisms, living, non-living organisms in the particular pond may be having following a certain patterns. Are we following the certain patterns in the same way nowadays? Is the same medicines giving the same results in the same days? No, it is not giving. Take an example of the Dakshin Pathar, southern area of the Maharashtra. The same medicines are there, but they are not giving the same results nowadays. Why it is changing? Is the soil fertility changed? Is the tolerance limit of the maize changed? Or any other factors are there which changes the ecological things or ethnographic things? That study, it is a maybe the quality study, but that quality study is a very important to do, to understand how the research will go. A simple study of biodiversity or a bio things, it may happen that it will come up with a new things, a new patterns, a new evaluation, a new innovation, and that ideas of the innovation will come up with your research designs. That is why the ecological things is very important over there. This is about one of the things. I think it is a 520. But we'll see now the experimental study designs. And the cohort, I will take a cohort, prospective, retrospective, Case control study tomorrow in the observation study designs. But we will cover with the experimental study designs, and some of the part of the experimental and some of the part of the experimental is tomorrow. So whenever we come up with a research design experimental, to understand the experimental basic design, some pattern is there that which we call as a stimulus. Stimulus. What do you mean by stimulus? There is a response, there is action, stimulus and response there is there. इसका मैं नाम भूल गई, मैं कल I will tell you tomorrow that what exactly the name of it. But the thing is that what the experiment is there, a simple difference is there in between the experiment and the intervention. Experiment and the intervention. What do you mean by experiment? A non-living things or the living things may be having the experiment, but in an intervention, totally the living things are involved. It is an intervention. Okay. Then take an example that I will tell you what is the experiment. Suppose there is a cage. In the cage, there is a rat. Rat is eating the food, wandering here and there, nothing doing, and we are just watching the rat. Okay. जैसे मिकी माउस को हम कार्टून में देखते हैं वैसे हम रैट को वॉच कर रहे हैं. Suddenly what happens? Somebody, your friend has been come and he just giving an electric shock to that cage. What will happen? What will happen? A rat jumps. Rat jumps. A sudden response is there. By whom? By rat. For what? By the stimulus. What is a stimulus? Stimulus, it is a electric shock. That is why when the normal things are going on, there is a no stimulus at all. But when the stimulus is going to the things, then the response will come. And what is my action? I need to study the behavior of the rat. Okay. Okay. This is a normal skin pattern of the rat. I have given the electric shock. What is my electric shock? It is my stimulus. But after the stimulus, what happened by the electric shock? The skin of the rat has been burned. How much percent it will burn? I don't know. I need to study about it. It's an experiment. Whenever we are coming to the non-experimental research, we are not doing anything. We are just going to study about it. Yes or no, or any experiments, or any correlations, any associations, before, after, and all those things we are going to study. But whenever the experiment is there, then the stimulus is there. Whenever any outer variable, any confounding variable, any mediating variable, any moderating variable will come up with to the dependent or independent variable, then there is a change in the dependent and independent variable. And that is, we want to know that how much change is there in the independent variable or how much change is there in the dependent variable. Okay. A certain company is there. It is going on very smoothly, having the share value of the 2,000 rupees. But suddenly some things has been come up and it has been merged with another company. Merge with another company. A stimulus is there of the merging. A merging stimulus is there. Then what will happen? Either the share of that particular company will be increase or it may be decrease. And what percentage of increase and decrease is there? It may be depends upon that merger. Then that is what we have the experiment of it. That how many 5 companies are there, those are having the mergers and the share market value has been increased or decreased. This is a pattern. It may happen that this company has also the merger. It may happen that the share value of this particular company has been decreased. It is a past data, but it is an experiment. It is an experiment. A stimulus will come from the outside. And that the stimulus will say you that how the stimulus will affect on or impact on the dependent or independent variable. This independent variables may be manipulated, or we are giving a outsider stimulus giving there, or we are manipulating the variables, and we are going to see and monitor and test that how the changes will come. How the changes will come. And this is what we call as a experiment. Basically, experiment. And this will happen to change the solving the problem. How it is? Because S20 is there, then 21 has come, 24 has been come. Something is manipulated, something is changing, something has to be monitored to having the better things. Betterment kaise aayegi? The things are there. So this is called, we call it as a experimental research design. That anything there is a relationship is there, cause effect situations are there, dependent variables are there, but the dependent or independent variables are manipulated by the outcome variable or any outer stimulus variables, and those stimulus variables may be mediating, moderating, or maybe confounding variables are there. Then we are going to study that how much percentage of change is there by the experiment, which is called as a experimental study designs. Are you getting me? This is called the experimental study designs. But the experimental study designs are of the three types. One is a pre-experimental or true experimental, statistical experimental, that is a time series, or the quasi-experimental. But I think the
I'm sorry, I didn't quite catch that. Could you please say that again?
time is running. So can we discuss this tomorrow or shall we discuss this today? So, yes.
This is quite heavy subject.
Yes, sir. This is quite heavy, and we need to understand that how the things will go.
And all terminology should be properly understood. If
Yes.
other members are agreed, we can continue, or we will.
Are we continuing with the experimental? Yes.
We'll complete experimental, ma'am, today.
We'll complete the experimental.
Of course, other members also, if they're happy with this. Sonali saying tomorrow. Okay. Okay.
Ma'am, we should do it today itself because tomorrow the other things are already
It's already
in task.
pre-planned.
Yes, ma'am.
other
So
things
that may
also
delay.
planned.
Yeah.
They may be delayed again. Just I will
Yes,
take a
ma'am.
10 minutes that at least I
Yes,
should
ma'am.
make you understand the basics of it.
Yes,
Yeah,
ma'am.
please,
Please, ma'am.
please, ma'am. Yeah, thank you.
So in the experimental study design, there is four things. Pre-experimental. Understand what do you mean by pre-experimental. Pre-experimental means the things are doing in the laboratories or in a simulation way. Okay, actually we are not doing the experiment, but we are make it as a simulation. Now there is a new concept in the research nowadays, which is called as a digitech. Take a simple example that we are preparing one machine of the, what do you mean by a model machine of sonography. Okay, it is the model machine, it is on the computer itself. Okay, the machine is not physically exist, but we can make a mathematical models in a such a way in the computer also that model is running, and it is giving the different simulations for the different data. That for which patient, which sonography is applicable, it can be simulated with a mathematical models. And that mathematical models are called as a digitech. Simple digitech things are there, which is called as a pre-experimental studies. This is all the studies are come up with a pre-experimental. It may be covered in the laboratories, it may be covered in the animal studies, it may be covered in a simulation ways, or it may be taking a what I say the experimentation things. But it is not actually the experiments. Physical experiments are not there. It may be one short case study, or it may be pre-test, post-test, or a static groups are there. But this is all done with only laboratories. ऐसा हो सकता है, ऐसा हो सकता है, इसके लिए जो किया जाता है, that is simulation things will come up with a what we called it as a prototype model. The prototype, if you are from the background of the engineering, then you can may understand the prototype. Prototype means छोटा सा design बनाया जाता है. Actually, it is not working, but it will show you that how exactly it will work. It is a prototype model. Then that prototype models, it will come up in the pre-experimental things. The second thing is that true experimental. Whenever the true experimental designs are there, you need to take a method of sampling method, first of all, and second one, you need to take a control group. Why the control group is there? Yes, sir.
One shot. What is one shot
One
case?
short case study. One short case study means only in a laboratory. Case studies are covered in a laboratories. It is a one shot case study.
Okay.
Laboratory only. We are hypothetically we are with a value, one value. Hypothetically. But that hypothetical things can be experimental in the laboratories only. Okay, that is a one shot case study.
Oh, okay.
Then
Right, thank you.
True experimental studies, whenever the true experiments are there, then it may be happen that the control groups are there. Control means standard groups are there. Standard means which is already published data is there. There is no need to take again the experimental study for the standard groups. Take a example as a value of HB. Value of HB is already given as a minimum as a 12. But it may happen that in many of the cases nowadays, it is 6 to 7. 6 to 7. Then the control group, there is no need to have the control value of HB value as a standard value. Standard value is not covered. So many research designs will come up with it as a before after, only after, only before, only. So a particular things are there with the Solomon groups, or maybe the 4 groups are there to study the toxicity of the data. Then the control groups are there that the toxicity is this level. Then this will come up with the 4 groups, that 1% toxic, 2% toxic, 3% toxic, 4% toxic. At the 4%, maybe a rat is dying. But how much toxicity is there? This is a Solomon 4 group study. The same design can be applicable with the variations of the drugs. That variations of the drugs will come up with a Solomon 4 group study. But actually, these are the true experimental studies, are the actual studies which is conducted with the funded projects, laboratory studies, or at the PhD projects, on the clinical trials, directly the clinical trials, and the studies is called as a true experimental study. Okay, but which is having the particularly control groups. Next one studies is called as a statistical studies, which is called as a time series studies. Time series studies will come up again with the predicted values. That is a multiple time series is there, or multiple multinomial data is continuously we are going to study, and it is a totally depends upon the statistical data. Statistical data means a model testing data, simulation data, a prototype data, or what we said is a prediction, regression analysis. This will come up with the statistical studies. Again, it is a model. Yes, it is based on the real model studies. Real model studies. Take a simple example that we are taking the management development studies, MDP. Okay, we are preparing a one model for the MDP in Pune district. Okay, model is a very effective model. My statistical studies and statistical analysis says that this MDP, it is a very effective. Then can I apply this MDP model, what I have prepared in the Bangalore? Or can I apply this model in the Delhi? Are the same leadership qualities or the qualities has been improved in the other cities also? That is called as a time series. Or either this model be applicable in the sustainability. Okay, in a sustainable data management, ये हो सकता है क्या? This is called as a time series. Particularly a time-based studies, that whatever the models we have been preparing, either those are useful in the future or not, which is called as a statistical models. And the quasi-experimental studies. Sometimes what happens, whenever we are doing the true experimental studies, a time series or time gap is occurs in between them. We cannot get the data by the random sampling method. Okay, because random sampling, it is a very important. Random is a replicable, random is a repetitive, random is having the local controls, random is having the randomly selected, and that random is very important word in the designs. So if I'm not getting the data with the randomly, then can I use the experimental study? Yes, we can use. But that is what we are called it as a quasi-experimental studies. Quasi-experimental studies means there are some conditions are there, some constraints are there. Those constraints are having blocks in the designs, a certain blocks or certain what I say, it is a lacuna in between the study. But considering that lacuna also, the study will go ahead and which can be useful in the next studies. जैसे कि medicine is there, okay, or yoga is there, a particular yoga position is there, but this yoga position cannot be applicable with a high BP patient. Quasi experimental study. Okay, disease will cure, yes, it will be cure, but there are certain terms and conditions. That terms and conditions, whenever occur in the true experimental studies, maybe it is a time lag, maybe it is a location, maybe it is a geographical constraints, or maybe it is a economical constraints are also there. Then with these constraints, where we are conducting the true experimental studies, which is called as a quasi experimental studies, because the data is not randomly selected, but the data is selected purposefully. A purposeful sampling method is involved in a quasi-experimental studies, but the random sampling method is involved in the true experimental studies. That is why there is a basic difference between the quasi and the true experimental studies. So this is one of the example is there. Okay. Research question is there. Is there a phone use and the sleep? Is there a significant correlation between the phone use and the sleep? Experimental study. Okay, independent variable is the minutes of the phone used before the sleep. It is exogenous variable. Okay, and dependent variable, that hours of the sleep per night. Okay, this is how many hours of the sleep per night. Is it depend upon the phone use, that how many time, how many hours you are, how many minutes you are using the phone. This is the things are there. So the natural variation of the sleep is depend upon the hours of the sleep. So the natural variation of the sleep patterns among the individuals, it may be the extraneous variable. Maybe extraneous variable. It may be not normal, but it may be mediating variable. This mediating variable may be affect on our hours of the sleep. So control statistically measure the average difference between the sleep of the phone use and sleep without the phone use, rather than taking the average amount of the sleep per treatment group. It is experimental. That is why I need to divide the data of the experiment into the two groups. The average difference of the sleep with the phone use and average sleep without using the phone use per treatment group. In this way, we can convert our design into the experimental one. Okay, this is the experimental design one. Now the research design correlational. You can see that the relationship is always lies between the +1 and -1. But you know that this relationship is in a statistical way. We don't have any numerical interpretations in between this. Numerical mathematics and statistics differ a little bit. That difference will come up with a correlational research designs, and this is a particularly non-experimental research designs. So whenever we come with a correlational research designs, it may have an explanatory, that is explain the association between the variables. and the prediction that anticipate the outcome by the other predictors. Okay, this is the, so one of the characteristics are there. The researcher collect the data at the one point, or in a single group, or two or more group, or maybe the correlation is statistical. Okay, or maybe the directly hypothetical value is there, and with the hypothesis where researchers want to seek the association in between this. So for this explanatory correlational designs, I want to share you that one story is there. There is a one web series on the Netflix, which is name is a Mentalist. Mentalist. You can see also the good episodes are there. It is about the research of the criminals. A serial killers are there, and they are studying about the criminals. And with that criminal theory, one of the lady from the Harvard University, she will join to that one of the two army officers in that theory, and they develop a new theory which is called as RBT, rational behavioral therapy, and the behavioral science is developed at that time, and that is a story in behind that the behavioral therapy has been developed. How the behavioral therapy has been developed? If a person can be studied for his history part, then in the future or in the patterns of the future, how he can behave. This is a behavioral pattern therapy or behavioral science, and that science has been developed over there, and the word RBT has come up, and that is the story of the Mentalist. But it is a proper research that we can call it as an explanatory research, and it is a longitudinal study of the 10 years, but the 10 years will contribute to the behavioral science theory. It is a very good web series. Some of the good things are also come up with the social platforms, but you need to see it with the attitude of the research and particularly research aptitude. Then we can understand how it relate to our designs. One of the next design, it is a predictions. Then we'll come up with outcome variables. Predictions means outcome variables. Tomorrow I will explain more about this again. So there is a one more design which is a diagnostic research design, but diagnostic research designs, it will come up with a diagnosis. What is the issue? What is the diagnosis of the issue, and what can be the solution of the issue? This is called as a diagnostic research designs. So series of the patients is there, indexing test is there, reference, there is a gold standard, and comparison between the test and the gold standard, which is called as a diagnostic type of research particularly. Survey theory is explanatory. I already taken you, because it is a total survey. Again, focus groups are there, short groups are there, long groups are there, and there is a quantitative analysis between the culture and the effectiveness. This is all has been studied in the explanatory research designs. So we are talking about the weak and strong case study always. So whenever the weak case study is there, there is a research question is missing. Data sources are single source, but in a strong case study, it is a multiple sources. Sample sizes are small and unrepresentative, but it's a large and diverse cases are taken in a strong designs. Theoretical framework is absent, well established. Data analysis, systematic, cultured, structured methods are there. Model testing is there. Replicability is there. Again, this is a bias control. This is the difference between the strong study designs. If a study design is a strong, the publication is a strong, the predictions are the strong, and this researches are the strong. So this is one of the example that impact of online learning of the student performance. This is a weak and not a proper objective. Researchers interview only one student from the one school. It is a very ineffective study. As a parallel, we are taking from the 50 students from the different schools. Data resources are taken from the students, teachers, survey data is there, academic performance has been, records has been covered up. This is all is called as a strong study designs. So this is a summary of the data that we have discussed all about this. But I have some quiz with you. A simple 5 questions are there, that this is a scenario and what the study design we should apply over here. Automobile company want to test whether a new engine lubricant improves the fuel efficiency. 100 cars that the new lubricants has been applied, a standard lubricant. Both the things are there, new as well as a standard. Then which study design will be applicable? Yes?
Experimental, ma'am, RCT.
Yes, experimental RCT. Yes, because two comparison is there. One is a standard lubricant. Whenever there is a standard is there, the control is there. And the new one is there. Comparative study is there. So it is experimental RCT. This is the second case. A school introduces a new teaching method and compares the student test scores before and after that change. They do not randomly assign the student. This is very important. They do not randomly assign the student to different teaching methods. Then which experiment is that?
Ma'am, because it's involved comparing, so I guess it is quasi experimental because there is comparing of
Experimental
groups.
because
No randomization.
no randomization. No randomization, but you can use over here cross-sectional also.
Yes, ma'am.
Yes,
Why
ma'am.
the cross-sectional? Because it is a new teaching method, first of all, and you are comparing test scores before and after the change. Cross-sectional will give you the change because it may be the survey method. It is a questionnaire method. Okay.
Yes, yes.
So both can be applicable. Quasi-experimental is applicable and cross-sectional is also applicable. Both can be applicable. Okay.
Okay, ma'am.
Third one. A company wants to understand a customer preferences of the organic versus non-organic food. They conduct a survey on a 1 month. 1 month है तो longitudinal तो नहीं होगा. Comparison नहीं है तो RCT भी नहीं है. It is not a case study at all. Then what remains?
Again, cross-sectional.
Cross-sectional, ma'am, because it
Cross-section.
involves collecting the data.
It involves only collecting the data, facts and finding
Yes,
in the
ma'am.
data, in the time
Yes,
series.
ma'am.
Facts finding in a time series. It is always the
Cross-sectional.
Cross-section. Medical research. A team of researchers follows 5,000 individuals over 20 years. 20 years. To assess the how dietary habits influence the development of the cardiovascular diseases. Which type of study it is?
Cohort.
Experimental.
No, sir. No, sir. It's a case control.
Yes.
It is a case control. Why the case control is that? Because we are having only one parameter, dietary habits. Okay. In every individual, we are going to study about dietary habits. And where we are going to compare with the control studies. Because the studies of the 20 years. 20 years तो बंदा काम नहीं करेगा. तो क्या करेगा वो? किसी ने और जो पब्लिश किया हुआ डेटा है ना, उससे वो कंपेयर करेगा. है ना? जो पब्लिश डेटा है, that has to be compared with our study and that is called as a case control
It
study.
may be retrospective.
Okay. But
Retrospective.
it may be
Ma'am,
may
it
be
can be
retrospective.
cohort.
It may be cohort also. It may be cohort also because the 5,000 individuals that we are going to study about cardiovascular diseases. Then we are taking a cohort as a person's having a cardiovascular disease. It may be one of the cohort and cohort में हम वो कर सकते हैं. Are you getting me? Cohort के लिए हमें क्या चाहिए? We need a particular specific group of people. That specific group of people, that the people is having the cardiovascular disease. It is a
Yes.
group of people.
Yes.
Yes, ma'am.
Okay. Next, employee productivity before and after remote work policy. Company collects the data on employee performance matrices for the 1 year before after introducing the remote work policy. To analyze whether the new policy led to a change of
Longitudinal, ma'am.
1 year देखो ना 1 year है यहाँ पर. Company collects the data employee performance for 1 year. They're telling about 1 year. Before after है.
Quasi experimental.
Pre-post design.
Pre-post
Before and after,
comparison
because
study.
it's saying before and after.
Before after experimental study. Simple.
Yes, ma'am.
Huh? Okay, a link between mobile screen time and sleep patterns. Researcher conduct one-time survey, means questionnaire is there. Yes, among the 1,000 teenagers, asking about the average screen time per day and sleep quality past month. Which study design it is? क्या बोला है? ठीक से पढ़ो. Link. Link means relation. Yes or no? Link means relation. Relation between mobile screen time and sleep pattern. There is a significant correlation between mobile screen and sleep patterns. What is the study design? Yes,
Correlational.
correlational, simple. Link लिखा है ना. It is a hypothetical saying that there is a link between mobile screen and sleep patterns. So it is a correlational. हम ये क्यों ऐसा कर रहे हैं? Because that it involves a title, a correlational study of mobile screen and sleep pattern. That may be the title of this study. That is why study design will reflect in your title. Whenever the study design is reflected in the title, the whole thesis will go very smoothly. Very smoothly. One of the title will cover a study design. Na? It's okay for all, everyone. Evaluators also will agree with your study. These are the some of the references that I have taken. These are some of my books. And thank you very much for patience listening. And
Thank you, ma'am.
Thank you, ma'am.
Thank you,
thank
ma'am.
you.
Thank you, ma'am.
Yes, thank
Thank
you.
you, ma'am.